Welcome back. We have been
Back.
gone a long, right? We've been gone for a long time. I am Tiffani.
And I am Andrea.
And we are Relatively Unstable. Make sure you like, follow, share, subscribe, all that good stuff. Even if you don't watch us. But now that we're back, we're going to be loyal. We're going to be good to you. We're going to bring it all back. We took a break, but we wanted to come back with something that is really, truly important to us. And for me, I'm super passionate about it. We're going to be talking about the vag, all the stuff around it, keeping it lifted, keeping it tight, keeping it strong, what goes in, what goes out, what shouldn't go in and what shouldn't go out. Keep it right, keep it tight. And we have with us some really cool people who are going to talk to us about what they do in this area. So we have Carly Britton, who is, let me get my, because I am so relatively unstable. Let me get my.
While you're getting that, I just want to say that I am grateful to see Carly in this capacity via Zoom and not the capacity usually, or not usually, but that I have seen her in. Her workouts.
So Carly brings the pain. Carly brings the pain.
They are no joke.
Yes, I will be seeing Carly in about 12 hours. Mm-hmm. So Carly is, all of us, by the way, D-girls. Carly is a wife and mom living in Detroit. She is alumni of University of Michigan. Go Blue. She has a degree in sports management and communications, and she currently is working at the DIA, Detroit Institute of Arts, which they have a really cool exhibit right now if you haven't gone to see it yet. And she also is a certified personal trainer and pre and postpartum fitness coach. So in 2020, she launched her own fitness enterprise to be Diligent Fitness. And she's passionate about helping people create sustainable habits, lifelong health and fitness, and loves working with her clients on their fitness goals. That was very red, which is so off brand for me.
So good.
But let's do it again. Let's do it again. And then we have with us Dr. Lauren Collins, who is a board certified physical therapist, certified in lymphedema. By the way, I actually know what that is. I've done a lot of writing on it.
Yes.
I have done a lot. So I've done some research in my own job on that. I have done some writing for a case for that. She's a professor of physical therapy in the physical therapy department of Howard University, which is also her alma mater. And she has practiced physical therapy for 23 years with an emphasis on women's health for the past 19 years, inclusive of pelvic floor dysfunction for the past 13 years. He specializes in craniosacral, is that right? Therapy, visceral manipulation, and myofascial release as part of her manual therapy skills. So we're going to find out what all that is. She's a sexual assault survivor, first responder, and has special interest in working with survivors of sexual assault. We should have had you on last month. We should have done this for Domestic Violence Awareness Month. So she works with people on domestic violence issues and cultural competency. She has specialized training in working with communities of color and LGBTQ communities. She believes in multi-layered healing and incorporates a philosophy of whole self-healing, which, yes. Lauren provides multifaceted workshops and training sessions to survivors, as well as those organizations that support survivors. So welcome, you two. We hope to learn lots going on here. So let's talk about what is pelvic floor health? What is the pelvic floor? First of all, let's go there. So what are we talking about when we talk about the pelvic floor?
Oh, you know what? I grabbed everything but one thing. Give me one second. Carly, I'll let you start and I'll be right back. I have a model and I can't believe I grabbed
I can't wait to see it.
I didn't grab my model. 1 second. Yes. All right. So what is the pelvic floor? This is my model of a pelvis. This is a vagina owner, or a person's a vagina owner. And so basically the pelvic floor are the muscles that attach from the front of the pubic bone to the back. So this is the sacrum back in here, to the back. And there's various layers of muscles. There's a superficial layer of muscle that helps to close off our sphincters, our urethra, our vaginal sphincters. There's another superficial layer that helps to close off our anal sphincters. This layer also helps with support to the clitoris. Then beneath this, we have a layer that gives a little bit more support into our urethral sphincters and just some support into the organs. And then if you look deeper inside of here, that muscle is called the levator ani. And those are the muscles that help give support to the organs in the lesser pelvis. So for vagina owners, that would be bladder and urethra, uterus and vagina, and then the rectum. But all the muscles in general have like 6 main functions. They have support of those organs, a sexual function, a toileting function. They have a sump pump function. When they contract and relax, they help to move our waste fluids, our lymph fluids out of our bodies. They have a function in stabilization. These muscles work with our deeper abdominal and back muscles to help give us core support. And then, what am I missing? Sex, toileting, sump pump, stabilization, and support. Yeah, so those are the functions. If I think of another one that I forgot, I'll let you know. But yeah, those are the functions. So this is what the pelvic, this is what I'm talking about when I talk about the pelvic floor and what it does.
And so you have a model for a vagina owner. So can you just give us a little bit of a picture of what that looks like?
Or a penis owner?
Yeah.
Yeah. So, okay, first of all, just imagine the vagina's closed, right? Mm-hmm. And it's pretty much the same. It's pretty much the same. Just imagine that the vagina is closed, but the muscles are pretty much the same, except for the vagina isn't there. And a muscle that is called, I don't know if you want all this information. In vagina owners, the muscle is called the bulbar cavernosus, and penis owners, it's called the bulbar spongiosus. But it's the same muscle. It's just there's no vagina there, and just the organs in a penis owner's pelvis would be the bladder and urethra, the rectum, and the prostate, right? So there's no vagina or uterus. But they're pretty much the same other than that, and they have the same functions. These superficial muscles in penis owners are what help with erection. They're what helps occlude the arteries to maintain blood in the penis for erection. So that's another difference there too.
Okay. So if we're talking about these muscles, obviously when we talk about muscles, they have strength, they have weaknesses. And this is where you all come in. And one of the things that I'm somewhat aware of is that, there are different factors that influence that strengthening and weakness. Can we talk about what those are?
Yeah, of course. Carly, did you want to?
No, go ahead. I'm learning.
So factors that can affect the strength and weakness of those muscles, there are so many. Pregnancy is a huge one, right? Carrying a baby and you're getting those muscles lengthened, which can weaken the muscles. That's one thing. Constipation, a history of constipation where you're chronically bearing down, that can stress those muscles out as well. People who have respiratory disorders, like where they're coughing a lot, all that coughing can cause stress on the pelvic floor as well. Another one of those, like if you don't use it, you lose it kind of thing. If you're not using it to help you stabilize, sex is great exercise for the pelvic floor muscles. So if you're not saying that if you don't have sex, the muscles are going to get weak, but sex is great for maintaining strength of the pelvic floor muscles. So there are all kinds of issues like that. And just because it's weak doesn't mean that it's lax. A lot of the weakness can come when the muscles are very tight. So we have people who are like, high performance.
So I'm sorry, can you repeat that, Lauren? Some of the weaknesses can come from?
So yeah, you want me to start from the beginning or from where I left?
Just from where you were about to tell us some of the other weaknesses.
Oh. So sometimes the weaknesses can be because the muscles are too tight or overactive. So you'll have high performance athletes who are just constantly keeping these muscles contracted. So they don't have the full range of motion for the muscles to move. And that lacks, so if my biceps muscle, let's pretend my biceps muscle is a pelvic floor muscle, like when I can relax my biceps muscle, my arm can get perfectly straight. So I have this full range of motion and all this power to pull up with when I want to use it. If for whatever reason, my muscle gets stuck and gets shortened right here, well, now I can only go from here to here. So my muscles, because I don't have the full length of the muscle to pull up with all the power. So the same thing can happen in our pelvic floor muscles where they're shortened and they're weak. And a lot of times when they're in that situation as well, they're also painful. So it hurts to have sex, or, they have other types of pain dysfunctions. So.
So since we're just right here, so what does that look like? Like, where is the pain in sex? Meaning, like what is it like? Where are you going to feel that pain?
So it depends. Some people feel it right at the vaginal opening, because the muscles that are more superficial are more painful. Or if you had tearing during birth or an episiotomy during birth, and that scar tissue can make those tissues tight as well. So sometimes it's just pain at the entry, and sometimes there's a dermatological issue. There are all kinds, but that can be irritating around the superficial, around the vaginal opening. And so that can be painful. And then some people have, like, those deeper muscles are tight, they're shortened, they've been overworked. And so the deeper penetration is more painful and achy. So it depends on what's going on with their bodies, where they'll feel the pain. Sometimes it's both, sometimes it's both with initial penetration and with deeper penetration. There's a condition called vaginismus. And vaginismus is where those muscles around the vaginal opening spasm upon initiation of penetration. So something is trying to penetrate the vaginal opening and the muscles just spasm, and that can be very painful for people. So that's another dysfunction to work with.
So how many people, or what is kind of like the stat on how many people are impacted by this typically, or that we know of?
So we don't even have true numbers, because people haven't really talked about it. Like, you just don't necessarily, I find women talk about it far more than men do, I will say that. But even amongst women, it's not like you just go to your girlfriend like, hey, my vagina closes up on me.
Hey, girl.
When we try to have sex, does that happen to you? Like, it doesn't just happen, So, but women do talk about it more, which is good. So I can't give you a direct number, but if I had to guess on, like, what I would say, and these dysfunctions just aren't pain with sex. Like, if you include urinary incontinence, fecal incontinence, pelvic organ prolapse, if you include, because those are three of the really highest types of dysfunctions. It's like 1 in 4 women between the ages of like 25 to 50 or something like that. I can't remember. So it's a high percentage of vagina owners that have some type of pelvic floor situation happen at some point in time in their lives.
So
it may not happen at once, but at some point in time in their life.
And I would imagine that it also is difficult to kind of keep those numbers, because people may be describing the symptoms of everything that is happening, but won't attribute that to the pelvic floor. Or,
yes.
They'll say like, oh, I just do this because now I'm 40, or, yes. Like whatever it is. So, so they probably aren't even thinking that, it's something much deeper or, more complicated than just age or whatever.
Yeah. And actually, sometimes you may not even feel it in the pelvic floor. Sometimes you feel it in your hips, or sometimes you'll feel it in your abdomen, so you'll feel it in other places, and it's actually coming from the pelvic floor, and vice versa. But so it takes a very holistic look. You have to take a very holistic look at a person to really get a good diagnosis sometimes.
Yeah, I think that is, I personally found that to be true, because I, first of all, did not talk about it for when I say very long time, I'm talking about a decade. But then, had to see a series of different doctors and go through a series of different testing that was absolutely humiliating, to finally go back to find a specialist who could tell me exactly what was going on, only to go to another specialist who was like, oh, and wanted to have me have surgery, but now I'm headed down the pelvic or the physical therapy road. And so I want to bring Carly in a little bit and talk about some of the work that you do in your training to help, because I do Carly's classes, I take Carly's classes, and one of the things that I hear a lot the area that comes up a lot is opening the hips. And so it was interesting to hear you say that you can feel the pain in your hips. I don't, again, like Andrea said, I think of my hip pain as, age, but perhaps maybe there's something else to it. Carly, can you talk a little bit about some of the method? Maybe you two can.
I was just going to point something out on the model so that you can have a reference for that. So in the model here, you see this muscle up over here? Mm-hmm. That is technically a hip rotator, and the pelvic floor is connected to it. Oh. So there's like this real close association between your hips and your pelvic floor. So sometimes something going on in the pelvic floor, you feel in your hip, and sometimes things going on in the hip, you feel in your pelvic floor. So that's it. I'm sorry, Carly, go. I just want to show that a reference point.
Totally fine. Yeah. So I'll back up to how this all sort of came about. In 2017, I had my second child. And at 6 weeks, I went back to the gym because my OB said it was fine. And they just release you and let you go into the wind. They don't ask any clarifying questions like, how's it going? How does it feel? Nothing like that. You're fine to go back and work out. And so I went to the gym, and first day back, did jumping jacks and peed myself. And I kind of made a joke on Facebook, like, haha, I didn't die, but I did pee myself. And a physical therapist that I used to work with at DMC, I was in marketing, she was a physical therapist. She messaged me and she was like, hey, that's not normal. I do postpartum physical therapy. See if you can get a script to come see me. And I was like, what's postpartum physical therapy? And she's telling me about it. And she's like, you have to get a script from your OB. So I called my OB to get a script. And I had to explain to them what it was. I didn't know. But I'm like, well, my physical therapist said that whatever. And I'm trying to explain it to them. And I was like, why don't they know about this? Or why do I have to explain this to my OB's office? So that happened. I was seeing her. I don't think she knew, so this is not to fault her. I don't think she knew that I was back in the gym. My coach had me deadlifting like 245 pounds, right? So under 6 months postpartum, I'm deadlifting 245 pounds and I herniate 2 discs in my back. And so for a long time, well, I actually went back to her and I was like, what do I do? This hurts, right? Because I went to the ER and they're like, oh, you just sprained your back. And I called her and I was like, it's more than that. Something is really wrong. And it wasn't until she was like, well, where were you doing deadlifting 245 pounds? And I was like, well, that's my workout. That's what I always do. So anyway, going down this long road of recovery was when I was like, under 6 months postpartum, probably not a good idea, even if that's what you were doing before. And so when I got certified as a trainer, it was automatic for me to get some sort of education in this pre and postpartum aspect, because no trainer that I ever had ever knew what was what, right? They don't know anything about diastasis. They don't know anything about the pelvic floor. They don't know anything about breathing and connecting your breath with your movement. None of that. So I knew that if I was going to be a good trainer, at least for me, I had to know some of that stuff so that I can at least send women in the right direction. So I don't know it all. Like when Lauren was talking, I was like listening because I'm still trying to like really get it deep down. But I think what my purpose in doing it was, being able to tell women, hey, if you have that baby, you should go see a pelvic PT. Like that's going to be your best move after you have this baby. And then we can work together on a program. So at least now that I know how to connect your breath with your movement so that all that pressure is not put on your pelvic floor and you're not like, your vagina is not like bursting through your butthole. Like at least I know that so that I can direct women. If you feel pressure or bulging down there when you're squatting, we're done. Like you need to go see a pelvic floor PT. You know what I mean? If you feel lightheaded when you're on your back and you're pregnant, you need to not do that. So it's like, I don't know it all and I don't know all the technical stuff, but I know the signs and I know some of the things that we need to be looking for when we're pregnant and when we're postpartum. So I feel good about what I can do for women in like directing them, right? So that's kind of how it all came about. So my really big thing is I can't do a ton virtually in a group setting with a lot of this, but you know, Tiffany, I emphasize breathing a lot and just being able to don't hold that breath in, take in air as you initiate the exercise, exhale on exertion, like that's really important. So I just try to infuse some of that education into my classes and hopefully, you know, I'm not helping women worsen their condition, which is what the main thing that I wanted to prevent was I didn't want somebody postpartum to come to me because I think women don't know better because it's not like a well-known thing. So when I tell a lot of women about pelvic floor BT, they're like, what is that? Same way I was. And so it kind of sucks that, you know, your OB doesn't say, you're good, but you should do this next. It's not something that you ever get directed toward. So that was kind of my purpose in doing it was I'm going to be that person. I'm going to be that friend that's like, this is not normal for you to be peeing your pants when you laugh. And it's not okay for you to be having painful sex. And I think a lot of times after when we have babies, they just automatically think, well, stuff's going to be wrong with me now because I've had this baby, my baby was 10 pounds and that's what my butthole feels like. It's going to fall out all the time. Like they just feel like that's normal. And you need somebody to be like, honey, you could get that worked out. So that was the whole reason why I've done this is just people need to know.
Yeah, I agree. I think that, you know, one of my questions to both of you is, you know, at what point do we start talking to our children about these things? Because I do feel like had there been more education, more, you know, conversation, I very seriously doubt through no fault of her own that my mother would have known to say something to me, you know, like, you know, after you have your baby, make sure you're taking care of, you know, all the parts that got this baby here, you know, because we just feel like, oh, that's what our bodies are meant to do. And that's just what we do, you know? So I will say that my son has already seen a pelvic floor physical therapist for something else, but I didn't even know that that was a thing for children. And you know, a lot of the things that we do in Carly's training are exercises that the physical therapist had him doing. He is 11, so how well he keeps up with it, yeah, we try. But there is a lot going on there. So yeah, please.
Can I speak to that a little bit?
Yeah.
Well, before I talk about my kids, first, Carly, that was it. Respiration was the thing I was missing from the functions. I was like, what function am I missing? It's respiration. Thank you. So I have two children. My daughter is now 22 and my son is 19. And my daughter, she doesn't mind me sharing. She told me, Mom, if this will help somebody, please feel free to share it. My daughter has vaginismus and she was a high-level soccer player. She played collegiate soccer and all that. And so she has had vaginismus. We've known about it since she was probably at least 15 years old, I would say. 14, maybe 14, 15. She tried to, you know, use a tampon and she couldn't do it. And so other things. And if I wasn't her mom, there was no telling how long it would have been before she would have been diagnosed or been able to go and see somebody about working on that. So because I'm her mom, I'm like, oh no, baby, that's not right. You know, now I can't be your PT, but I'm going to send you to someone who can, right? So we started her back then. Now it does get harder for like teenagers, and my daughter with soccer, she got recruited to a boarding school. So she had roommates. So you can't always do all the things you need to do when you have roommates and, you know, you're in these kind of communal settings. But she's been working on it, you know, and she's had progress. But so it's never. I don't think it's ever too early. My son is admittedly says I know more about vulvas than some of my vagina owner friends. Like, because I'll have pictures of him up in the house, you know, or like he was in the bathroom one time and there was a poster up of I do this artwork project with survivors where they make their felt vulvas to connect with their bodies, and so I have a poster up of different felt vulvas. And so I guess he was Zoom talking or FaceTiming with a friend of his, a vagina owner. And she was like, are those vulvas behind behind you? He was like, yeah.
Yeah.
So like, I don't
Thanks,
think it's too early. I think that helps with their own body awareness and connecting themselves to their bodies, as well as in terms of just kind of going back to that whole sexual assault thing. People who are perpetrators are less likely to commit acts of sexual violence against children who know their bodies, because they can say what's going on. Not to say that, I mean, it's horrible when it happens in any case to anybody at any point in time, but if a child is well-versed about, it's a deterrent if a child is well-versed about their bodies and knows that. So.
And they're comfortable, you know, it's harder to intimidate them with words. And so I 100% agree with that.
Can you explain what that condition was? Because I had never heard that term before. What is it and what happens when you have that?
Vaginismus. That's what I was talking about earlier, where there's the muscles at the vaginal opening, they spasm upon penetration. So that's vaginismus. Now the condition where you have pain with intercourse is called dyspareunia. So I don't know if y'all want to know all that, but those are two names. So vaginismus is something spasms up when the muscles at the vaginal opening spasm up with initiation of penetration, and dyspareunia is pain with intercourse.
Wow.
There's a lot there, right? Alone. But even, you know, for women or vagina owners who haven't had children, even just the natural aging process, you know, and again, for in our case with my son, you know, he had a surgery when he was an infant that you know, caused some challenges for him. So I imagine that, you know, far more people need to be aware of these things than are, you know, and again, it's, you know, to Carly's point about, you know, your butthole, like that can be quite shocking if you're not, you know, you're expecting it. So how do we keep the conversation out there and make people more comfortable talking about this, knowing that, and again, the first time I heard of, you know, actually, Lauren, I saw you on the news one day. I mean, but I've known you for a long time. I've known you and your sister for a long time, but I really didn't understand, you know, but there was a segment on, I think Fox 2 maybe. And between that and a passing mention from a coworker, that was really all I kind of knew about, you know, this specialized therapy. So how do we keep this conversation, you know, alive and make it and normalize it for people?
Carly, you want to take this one or?
Well, no, I want you to chime in too, but I was just going to say, I think that's part of what I'm trying to do is, I mean, I think everybody that I know in life that's had a baby since I've been certified, or even like when this happened to me and I did pelvic floor BT, I'm like, take, you know, after you have your little 6 weeks, this is the next step for you, just talking about it, because people, like I said, have no idea what this even is, because our OBs aren't talking about it, which is kind of sucks. Our OBs aren't talking to us about it. And I just think it's, I also see on social media, I see a lot of really good pelvic floor PTs being very open about this and talking about it, where it's educational, where it's funny. And so I think, I don't know, I think the conversation is open. It's just that more people need to know about it. And I talk to everyone about it when I'm training. You know, the breathing thing, people may not connect it to the pelvic floor, but it's all connected. Everything is all connected. And I think we just need to talk about it more, because I think part of it is, like, I can say that I'm really open with my girlfriends, and I think women are open to talking about like sex and all these other things. But when it gets real embarrassing, like when you're like, I have hemorrhoids, or I have like, it feels really bad when I do certain things down there, we might not be as open to talk about it because we feel like ashamed to talk about some of those things. We don't know how common they are. So it's just, I think just talking about it more is gonna help.
Yes, because I'll tell you, the worst thing is trying to Google a symptom and nothing comes up in Google, and you're like, am I the only person that this is happening to? Like, wait, like WebMD that doesn't come up with anything. But yeah, I think that I mean, I know about it from Tiffani because she posts about it a lot, but you know, and we've talked about her struggles with it or whatever, but like now I'm like, okay, this feels like something that I need to pay more attention to, that I need to be, you know, not looking for issues, but like just being more aware of like what my body feels like on a regular basis, and like if there's any changes, you know, and finding an OB that is open to talk about that kind of stuff, and like, oh, like I have these shooting pains here. Like, what is this related to? Or could this be related to the pelvic floor? Like what, you know, and just, I know after this conversation going forward, like that's going to be something that I'm going to be talking about with my doctor, and like saying like, how is my pelvic floor? Like, what do you think about it? Like, is it okay? Like, what's going on? Like, you know, and just like letting them know that I'm also checking so that they can also be, you know, even if they don't know and need to refer me to somebody, but at least I can start that conversation.
I think
that's great.
Awesome. Yeah, I think that's awesome. And I agree with Carly. The way we get it out there is to talk about it more. And like she said, if you bring it up, you'll be surprised how many of your girlfriends will say the same exact thing. Same, or if not the same exact thing, something similar to it. You'd be really surprised. And then to talk to your doctors about it. I mean, we go out and we see that you know, go and talk to doctors, and some doctors come and talk to us, but really it's through our own personal word of mouth, peer to peer, you know, or us to our physicians where this gets said. And if you go to your doctor and say, hey, how's my pelvic floor? They might not know. And I say that because they are skilled at going and getting PAPs and going and looking for cultures and they're not skilled at, I mean, not to say that they don't learn about it, but that's not their specialty. They're not musculoskeletal specialists, right? PTs are musculoskeletal specialists. So they might not know what to do about your aching pelvic floor. I can't tell you how many patients I've had where they say, you know, tell their GYN, I have pain with sex. And they say, oh, drink some wine. You'll be all right. Like, I've heard that from too many of my patients. You know, like just drink some wine, it'll help you relax. Like, so a lot of them just don't know, which is so unfortunate.
That is really bad advice.
Really
Very.
I mean, like on like
good
a medical
advice.
level,
Right? But it's
like
terrible
a moral and social level, like that's really bad advice. Like, yes, you have to get drunk in order to have sex without pain.
Yeah, no, it's not good advice at all. And in DC, we have something called direct access. So in DC, you don't need a prescription to come see us. You can just come straight to us.
Nice.
That's amazing.
Yeah, we're considered primary care providers. I think in Michigan, it may be changed in Michigan now too. It may be that you have direct access for a limited. You do?
You do.
Oh, okay.
Yeah, I certainly needed
I did. So
it may have changed since you went, maybe, because it may be a limited number of visits that you can go, that you have direct access for. And then beyond that, you have to get a physician prescription. I'm not sure though. So don't quote me on that. But I think most states are direct access at this point in time. It may be limited though. But in DC, we just have direct access.
Yeah, I think this is one of the things I wanted to talk about was, so Carly, you mentioned that first of all, let's back up to your 245-pound deadlift. Oh. So now I feel like I'm not going to go to class tomorrow because I thought I was doing something with my 30-pound weights. No. So yeah, that, but what is it? So we talk, I follow a lot of the pelvic floor specialists on social media, and there's a lot of discussion about weight training, you know, as being good for the pelvic floor, but for a person who's not trained, me, it seems kind of counter to, you know, if bearing load causes prolapse, then how does weight training strengthen it? And also, I do think maybe Lauren, could you just talk to us? Let's talk about what prolapse is, because we've thrown the term around a couple times, but we really haven't described it. Carly described it beautifully,
Something.
but we didn't connect the dots.
You want me to describe that first, or you want Carly to talk about the strengthening part?
Let's talk about what it is first, and then Carly, can you chime in?
So prolapse, we have connective tissues. We have these ligaments that help to hold our organs up in our pelvis. So we have ligaments that help hold up our uterus and our bladder and our urethra and then our rectum. And when we have a lot of overpressure or bearing down that's not controlled through our internal mechanisms, when we bear down like that, it puts a lot of pressure and can stretch those ligaments, right? And they don't heal back fully and completely once they've been overstretched. And so what happens is the organs that were now sitting up, pretty high up in the pelvis now are kind of sinking down lower into the pelvis, and you feel it through your vaginal wall. So again, I'm gonna pull my model out here. So just like, side view, the bladder sits right behind the pubic bone here, and right behind the bladder is the uterus, and behind the uterus is the rectum way at the back. So if those ligaments that are holding the organs up, like if the bladder, which is at the front, if those ligaments get lax, it's going to sink into the vagina right behind it. And so you're going to feel that bulge come at like the front part of your vagina. And if the ones holding up the rectum in the back get loose, then you're going to feel a bulge through your vaginal wall at the back of your rectum, just kind of bearing down into that vaginal wall. And so there are times when we have to have people splint through their, like they'll put their finger in their vagina to help splint to push back the rectum, or to push up the bladder so that they can pee or defecate or, do those.
Are you okay, Andrea?
I am very not okay.
So that's the prolapse. And sometimes the uterus itself can prolapse. And then there's something called an enterocele, where part of the small bowel will actually prolapse. That's rare. We don't see that. I haven't actually physically seen that. So there are all kinds of prolapses, but that's what it is, when those ligaments or those connective tissues get loose, and then that organ, sinks into the wall of the vagina.
Super fun stuff.
Yeah.
And again, if you're
Talk
not
about that wine, shit, I need wine right now.
Wine, we need something.
Jesus.
So Tiffani, what you were talking about, as far as weight training and bearing down, that's exactly what you don't want to do, which is why I emphasize a lot breathing and breath work and connecting your breathing to your movements, because you don't want to be bearing down on exertion, right? So you want to be breathing out, letting all that pressure out on the hardest part of the exercise. So that would have been helpful for me to know when I was deadlifting 245 pounds. Should not have been doing that 6 months postpartum anyways. But for just regular lifters, and this includes penis owners, they have to know how to breathe so that all that pressure is not bearing down on the pelvic floor. So breathing is super important. Weight training, in the weight training aspect of strengthening everything down there, you have to be able to connect that breath with the movement, so all of that pressure is not contributing to bearing down on those organs and those ligaments and stuff. So that's why it's super important. And I don't think people don't know this because trainers aren't teaching it. And I don't claim to be the best trainer in the whole world, but I have never had a trainer teach me anything about breathing. I ran college track, never. And if you have, a team full of young women, we should be talking about this in college athletics. Like, we shouldn't be ignoring this, because these women are going to go on to live adult lives. I mean, women in college are having lots of sex too. So we need to be, and people need to be aware. I remember in college, I had some stuff going on and I was scared to talk about it, because what's happening? What's going on here? And, it shouldn't be that way, especially if I'm on a team. We have a team doctor. Why isn't anybody talking to us about this? We're out here lifting weights, probably blowing all kinds of things out. I know gymnasts have a lot of a high incidence of this happening. Are we talking to anybody about this? Or are we just letting them blow out their vaginas and go on and graduate? I don't know what's happening, but I shouldn't have been a college athlete and only learning about this when I'm 35 having a baby. So I really think that we need to start looking at that model to our female athletes.
Yeah. And I would say, Carly, the same thing. I Well, I was a young mom. You know, I had my first child young, so everything seemed to just pop back in place, you know, after delivery. And he was a smaller baby too. But the second one at 35, it was a completely different postpartum experience. And the one thing I will say about the mother that I do have is she was always very open about our bodies and things like that. But that was just not a discussion, because again, I don't think we had that information ourselves. And I love my doctor. I've been with him since my first pregnancy 26 years ago. But even he, you know, didn't give me all the information. And when I say like I trust him implicitly, even he didn't give me all the information that I needed to really address the things that have been going on with me the last 10 years. And, you know, what he would tell me, and Lauren, I'd love to ask you about this, just so that women are not so confused. You know, he'd say, oh, the muscles are strong, you have good support. But I'm like, okay, well, if that is true, why am I having, you know, the issues that I'm having? And I will be very transparent on Relatively Unstable. And that is that I'm experiencing prolapse and something called Erectile, which is super fun. Look it up. It's amazing. But it required a lot of searching and doctors to get to that diagnosis, and to now even be going to physical therapy to try and avoid surgery.
So, and I'm sorry, I don't mean to just like, do you have a cystocele or urethral?
I don't know. It's Erectile. That's all they told me. That was what the diagnosis was on the paper.
Okay. All right.
The cystocele is bladder, right?
Cystocele is bladder. A urethral is the urethra.
No, but
the rectocele.
The rectocele, it has caused a lot of urinary issues.
Oh, you have yes, you have a rectocele. Lord have mercy. Yes. I am losing it today. I'm so stuck on bladder. No, we're good. I'm with you.
So Carly talking about doing the jumping jacks. When we go to do jumping jacks in class in the morning, like right before class, you know, which is funny because now I've learned, oh, maybe you shouldn't, you know, be peeing all the time to make sure you're empty. But you know, doing that, like when Carly's like, oh, we're about to do jumping jacks, I'm like, 50-50 chance of what's gonna happen right here.
No, what he was trying to say there is, and I'm sorry, Erectile, I had the biggest brain fart. I was so stuck on, please forgive me.
No, you're fine.
I don't even know how that happened. But anywho, so when he says that your pelvic floor muscles look stable, so as I just said, the pelvic organ prolapse doesn't have to do with the muscles necessarily. That's more of a dysfunction with the ligaments that support them, right? But depending on the degree of prolapse it is, so if it's a first degree or a second degree, making sure those muscles are strong will really help diminish a lot of the symptoms that you'll have. Now, if it's a grade 3 prolapse, and this goes for anyone, if it's a grade 3 prolapse where it's starting to come out of the vaginal opening, then exercises will help, but you're still going to feel something, and you may have to use like a pessary or some other type of supportive device to help with that. If it's like a 4th degree rectocele, cystocele, whatever it is, then that's like a complete prolapsing of the organ out of the orifice. And so that is surgery. When it's at that stage, that's surgery, because it's a connective tissue disorder. It's not dysfunction, I should say. It's not a dysfunction of the muscles. And so when he says your muscles are strong, that too can be questioned, because strong is relative, right? I mean, there are degrees of strength. How much strength do you need? How active are you being? What do you need? How strong do you need your muscles to be to do what you need to do? So what he may think would be fine for somebody else may not be your daily life functioning activities that you need to be fine for. So, you know, so that's why.
Yeah. And I just feel like women need to be asking these questions, you know, because I didn't ask. I was just like, oh, okay, you know, which just continued me down this road of, you know, basically living with it instead of, you know, pushing
Mhm.
So, what are some of the things that we can do, in our day to day, just in our normal life, or I should say, what are some of the things we are doing in our normal lives to kind of, trash our pelvic floor? Like, what is it that we're doing that we're not taking care of ourselves in that way, or not thinking? Because, like, I can say, for me, I am so aware of this now. Like, I am constantly thinking about, supporting my pelvic, like in the workouts we do. Like, if my son jumps on me, because he's now almost as tall as I am, like, I immediately, like, lift the muscles up to brace myself so that I don't just, so what are the things that we're doing that are kind of where we could be more aware in our day-to-day lives?
Well, one thing Carly talked a lot about, and that's breathing. So knowing how to do a diaphragmatic breath and coordinate. We call it the canister, and I don't know what you call it, Carly, but we call it the canister. Coordinating the canister, so your diaphragm and your pelvic floor are working in sync with each other and supporting each other. The other thing is huge is like defecation mechanics, like not straining when you're going to the bathroom, using a squatty potty or having a stool under your feet, getting your knees up above your hips, and then, not holding your breath when you have a bowel movement, breathing through it is another thing. So that straining is a huge, bad thing for the pelvic floor. The other thing is slumping your posture. Like, people are sitting at computers more and they're slumping their postures. And all of that is putting pressure it's shortening your abdomen, first of all. So it's shortening, it's closing on your diaphragm, so you can't expand your ribs as much. And it's putting more pressure into your pelvic floor. So that's another thing. So working on sitting up nice and tall is huge. Things when you do, like when you go to cough and sneeze, think about coughing and sneezing. Because you should be pulling up with your pelvic floor when you go to cough or sneeze, right? And the most times people are like bulging when they're coughing or sneezing because they're not controlling it. So having that, knowing about that, and other things, like when you're going to like lift a load of laundry, take it up the stairs, or if you're a new mom, you're going to pick your baby up, stabilizing with your core, your full core, meaning your abdominal muscles, your back and your pelvic floor before you go to do those kinds of things. So these are just things you do on a daily basis that'll just help support you and keep your pelvic floor range of motion,
that we're not even thinking about. Like, we're just taking it and laughing with our friends about it, like nervously, like, haha, I had to change my pants after, like whatever, or I keep underwear in my car, just in case, or, one other thing I want you to go back to, because this is something, just in the event that the two people with penises who listen to Relatively Unstable get this far, let's talk a little bit about that and what that looks like in the male or the person with a penis, like in their world. Like, how are they impacted? So you spoke about erections, and so I'm sure they're all interested in ED, and is that something that's commonly I should say, like, when there's erectile dysfunction, is that more commonly than diagnosed an issue with the pelvic floor? Do you understand what I'm saying?
Oh, I understand what you're trying to say. No, a lot of times the doctors will just give them drugs. You'd be like, here,
right,
take this, and they don't even check out the pelvic floor so much, which is unfortunate. When really their pelvic floors probably should be looked at as well, not to saying that, some of the medications won't be an adjunct or, but like looking at both of those things.
Have you seen success with physical therapy to kind of get them back up
to
and
have
running?
full erections? Mm-hmm. Yeah. Yep, absolutely. And erections there are varying degrees of erections, right? There's different degrees of flaccidity to full-on erection. And so, you'll have to say, oh yeah, I was at like a 2 before, and now I'm at like a 4, until they get to so absolutely, like you see you going through pelvic floor training, getting those muscles strong, how their erections will be better, their ejaculation will be better, their orgasm will be better, all those things. So.
And what is it that's, we talked about, childbirth, being one of the big, violators of our bodies. But what is it that with men or people with penises what is like their big injury that would cause pelvic floor
So
dysfunction?
honestly, just as a whole, vagina owners tend to have more issues with pelvic floor, but that's because of the dynamics of our pelvic floor. We have a vagina, so we have this, in our pelvic floor, we have this hiatus that things can go through easier than penis owners do. So just intrinsically, by the state of being a vagina owner, we tend to have, and we carry babies and, things like that. So penis owners don't tend to have as many pelvic floor issues when it comes to that. They definitely do, just not those kinds. And so the main contributor that I see penis owners for a lot of times will be after they have, if they have prostate cancer and they have a prostatectomy. So sometimes they'll have urine leakage from that. So working with them on that. I'll see people for erectile dysfunction. Sometimes I see penis owners for like pelvic pain. And that can be varied. It can depend on maybe they're, like I said, athletes and they've overworked their pelvic floor. So they've strained their pelvic floors trying to lift or do something like that. And so we'll work on that. I've seen penis owners with pelvic pain because of a history of sexual assault, so there are varying things, but as a whole, there tend to be more vagina owners with issues, but for sure, penis owners have their I don't know, realm of challenges as well. Yeah.
Yeah, that is something that I didn't think about, other than, outside of, my son and his surgery, which, that's kind of connected to nerve issue. But I would have never known that. I have had so much education today. So what would both of you, be your takeaway, when it comes to pelvic floor? Like, if you are really simply just having a casual conversation about the pelvic floor, because, it comes up all the time, what's your takeaway? What do you leave people with, when it comes to taking care of this part of their body that I just really think is so, unfortunately, I think there's a growing comfort of people, using the proper terms for body parts, and but I still think I am what I feel like is a pretty open book, but it is still an uncomfortable thing for me. I'm more comfortable talking about it with you all in this platform than I am, talking to my doctors sometimes, because I'm like, they're right there, in my face or other parts of my body, talking about this. So, I
had a question before you get into the takeaway, and sorry that I was gone for a little bit, so this might have already been addressed, but I wanted to ask about how does fibroids affect the pelvic floor? Because I've had 2 surgeries now, and I'm assuming that if I ever wanted to have a kid in the future, that I would probably have to have a surgery before starting that process. So like, does having fibroids affect it at all, or is it a non-issue, or is it something that, as someone that has fibroids, should be concerned about, outside of already just being concerned about it?
Well, fibroids, if depending on where they're pressing, they can cause painful episodes to happen in the pelvic floor, right? And if something's painful, your muscles automatically kind of protect. They spasm to protect, right? They tense to protect. So if that happens, it's learning how to come out of that protection state to, let your muscles relax, so you can maintain good range of motion. I mean, pain is a normal function of our body to help protect, but we have to know how to come out of those protective states, essentially. And if you've had surgeries too, well, then with surgeries, you have scar tissue. And if they did like a laparoscopy or an abdominal surgery, the least invasive is the best kind of surgery. But if they're, going to the abdomen, you're going to have scar tissue, and that scar tissue can overflow into the connective tissues of the pelvic floor. So just making sure that those things are mobilized, like you're doing some massage, to those areas, you're stretching and things like that, staying mobile. So those are all things that people can do if they have fibroid surgery. And they have the fibroids themselves, you know, to learn and listen to advice. Okay, I'm having pain right now, and I understand what my body wants to do about that. But let me also try and, you know, relax and breathe through this and stretch and try and keep everything mobile at the same time.
Yeah, because I've noticed that, like, I mean, and this could both be a function of the fibroids and also just like when I'm getting close to my cycle, like it's just like a heaviness that doesn't feel like, I know that women get bloated and they, you know, whatever, but like it's a palpable heaviness that I feel like that feels different than just me being bloated or whatever. So, you know, and I'm trying to be more aware of like when that happens, like the times of the month and like, you know, how that feels and any pain associated with that. And especially after this conversation, like I said, I'm going to be even more aware and trying to be more in tune with that. But that's good to know about like the massages and like trying to like release the pain, since my body is trying to do that probably, you know. So good to know.
And sometimes, you know, once past menopause, fibroids don't occur as frequently. I mean, they shrink sometimes, you know. So it's the hormones of our bodies within our years of having a menstrual cycle that contribute to, you know, the growth of fibroids and things like that. So beyond menopause, they can start to shrink. And so just things to know, you know, just things. And that's another thing. Can I say this real quick too? You know, if for the people who are listening, who are maybe of an age that's over menopause, you know, sex may be uncomfortable for them because of the hormone changes. Now their vaginal walls are the thickness of the vaginal walls are changing. And so, you know, nothing's wrong with a little bit of estrogen cream. You know, go talk to your doctor and see if maybe you need to maybe not take full on hormones, but a little bit of estrogen cream can help thicken the walls and help with intercourse. So just things that people should know that they're not necessarily told. You know, it's just like, oh, I'm older, so that's just supposed to happen. But no, it can be helped, you know. And we can't change menopause. That is what it is. But you can do something to make it more comfortable or make it more pleasurable. So
yeah, I just feel like we subject ourselves to so much, you know, just as people in general, because we either don't want to talk about it, we don't want to be a hypochondriac. I think especially, you know, those of us who identify as women, you know, we're constantly like, oh, you complain too much, or, you know, just stop whining, whatever, or, you know, and I would just absolutely tell, especially like, it's like one of those things, had I known then what I know now, I could have saved myself a lot of grief, and I would love for somebody else to, you know, not have to go through so much. And there's so many resources. There are so many resources, but you have to also, I think it has been established, be your own advocate and really push and try to find ways to get comfortable with the conversation. If you have to come talk to us, you can come talk to us because we'll talk about anything. But getting comfortable with the conversation, you know, and, you know, from little, and talk to your littles about it, you know, talk to your teenagers, you know, like Carly said, you have, you know, student athletes who, you know, student athletes are, you know, they're a product. So, and there are lots of them at any really good school. So or professional athletes too. So they have to, there's only so much resource if they're not speaking up for themselves, or if they don't know how to speak up for themselves. You know, this is so important. So important, I think, it's one of those things we just don't even understand until it happens. And you don't want to understand it like that.
No.
That's not the way you want to learn about it.
no.
Really quick, is there so I know well, I'll share this because I think I've seen, Carly, you've posted about, you know, the manner in which you deliver a child and how that impacts the pelvic floor I had vaginal deliveries, but is there a difference in vaginal delivery versus cesarean and how that's impacted, especially because with cesarean, you know, they have to cut through muscle and, you know, it's like, to me, it's like, it could go either way because cesarean, you're cutting through muscle. Vaginally, you're like, there's pressure if you're not pushing correctly.
I think you're screwed either way. Lauren probably can talk scientifically than I can, but I mean, I think in all the cases, you're experiencing diastasis. 100% of pregnant women are going to get that. And pregnant women are going to get that pressure that's on their pelvic floor. And every pregnancy you have, it's like you're stretching more and more with every pregnancy you have. So those things are the same. And yeah, with delivery, there's different like issues. But I think another thing that, you know, my OB never told me was to massage my C-section scar and make sure that like that doesn't get too hard. And you know what I mean? Like that's just stuff that you don't get that information at your 6-week visit. Okay, you should be massaging your scar. And if it hurts when you have sex, you should go see about that. And so I think C-section and vaginal birth, you're both of those are just like, you need to go see somebody, like either way.
Yeah. And I also wonder, like, just even when, you know, getting coached to deliver, like, I can very clearly remember my delivery with my last one, the difference in the delivery between the first and last one. And, you know, the nurses are coaching you through, you know, push against my fingers, but really if you're not in tune with your body, you're still possibly not pushing with the right muscles or letting the baby is delivering themselves. And with Jacob, it was a much, even though I didn't even know about all this, I was more aware of, you know, what muscles I was using to push him or to, you know, to get him into this world as opposed to fighting it and pushing again, you know. And I think I wonder, and Lauren, maybe you could speak to that. Like, I just feel like that's not a thing. Like, they're not really telling us that in Lamaze classes, like, you know, like training us to push correctly or
how to breathe.
Well, I think they try to, but I don't think it's effective because I think you have to feel the person breathe. You have to see what they're doing. You can say it all day long. It doesn't mean that the person is doing the correct movements with their bodies. So I'm a big advocate for doulas and midwives for that as well. But, you know, I agree with you about the positioning. Like, I would get really irritated when a patient comes and says, oh yeah, my doctor had me on my back pushing the baby out. You know, why would you do that? Like, why wouldn't you let gravity help her? Like, why wouldn't you let her go ahead and squat and like let gravity help her push the baby out? They do that because it's convenient for them to sit at the edge of a table and with you on your back and deliver a baby, not because it's good for the mother or the baby, you know. Now there are sometimes like where the mother will want to be maybe on you know, her back, but his back, their back. But a lot of times that's not like the ideal position to deliver a baby in, you know. Squat. The same thing with defecation mechanics. Like some king over in England some hundreds of years ago decided he wanted a throne, literally a throne to sit on to use the bathroom, and now everybody's like constipated because they're not squatting. Because they're not squatting over their toilets in the ideal position they should be, right? So it's the same.
Is that what they were doing before?
Yeah, people, you know, you go to other countries, they squat over holes to have a bowel movement. Like, that's because that's the position your body is supposed to be in to have a bowel movement.
So that's why we have the squatty potty.
The squatty potties, right? That's why they have
for your legs.
I know have mine. I know after my second child, because my first baby was C-section, second baby was vaginal. And I didn't know how I was going to get that first poop out. I was like, Lord Jesus, I don't know how this is coming out. Because I felt it and it felt like a brick. And I was like, I don't know how this is coming out. And one day I leaned over my first baby's bed. I was tucking him in bed and I was on my hands and knees. And I was like, this is how it's coming out. And I got a bucket and I told my husband, don't come in here. I'm trying to. And the first few poops I had were on my hands and knees into a bucket. I know that's a lot. But
thank you for sharing that. Like, that's real.
Yeah.
That's real.
That is
I'm so glad. And I came upon it, but nobody told me. I was tucking my child in bed and I was like, this is it right here.
Happening right now.
Mm-hmm.
it is. You do
Love
sometimes have to go with what is like instinctual, like in the moment that you, and I am so sorry to everyone about the noise in my house behind me. But you have to go through like some discovery that, and unfortunately that discovery is inconvenient. It is
walking on me again, use the bathroom. I told him and he came in anyway. Sir, I told you what was happening in here.
Well, you had a second baby, so all good.
I did.
That's love. That's love. And maybe he understands a little bit better now that
I think he's
now that he's experienced that with you.
Yeah, totally.
Yeah. So going back and just wrapping up, because I could listen to both of you all day long and talk about this, for hours, but we want to be respectful. What would you take away? Like if you, want to leave us with something, what is that?
I would say have the conversation. If something doesn't feel right, tell somebody, and I think don't stop until you find the answer, because what I've learned, not with just this, with a lot of things, like medically related, if I tell the doctor and they tell me to just like go have some wine and that doesn't feel right, like you need to go till you find somebody that actually is going to help you figure out what's what. Don't stop having that conversation, because whatever you're experiencing is not a new thing, right? You shouldn't be, hopefully you're not ashamed of what you're experiencing. The doctors and the specialists that you're going to see have seen it before, and not to be afraid to talk about it and keep going until you find answers.
Yeah,
I think.
I agree with that.
Thank you, Carly. Lauren?
I would just say I agree with Carly. That know that these things you're feeling aren't things that you have to deal with, and maybe if you can't make it go away all the way, you can make it better, So, keep being your own advocate,
Yep.
Like Carly said, if your doctor says something that doesn't feel right, then you push past that one and you go on to the next. So, be your own advocate, and, just know that this isn't how things have to be. There's an answer somewhere. So,
yeah. And
it's so hard to be your own advocate sometimes, especially like I'm thinking back to some issues that I had that I'm thinking like, yeah, when the doctor said that that didn't make sense to me, or that didn't feel right, or whatever. And then life gets in the way and you're just like, oh, well, it's not that much of an inconvenience. It's an inconvenience, but it's not like life or death. It doesn't feel like. So, and I don't really have time to make another appointment, and I don't really have time to but the alternative is that you don't really know if what's happening is life or death until you get into the situation where it's life or death, or, very, very serious. And you just need to find the time, because if you don't find the time, then you won't have time at all. So,
well, sometimes it's not life or death. Sometimes it's more quality of life. Like something is hurting constantly. I mean, you're not going to die probably, but are you really enjoying your life like you would like to? Is that preventing you from, I got asked to go somewhere today, but I'm really in pain. I can't go. You're missing out on things because this thing is there. I think quality of life is just as important probably as life or death stuff.
100, because it will play on your emotions terribly. If it's something that you don't feel like you can talk to someone about, or if you don't feel that you have the proper support, and I would say that too, make sure you go to people around you who will support you, especially when it's something as personal as this. And this is super personal. It's, what we're trying to do today is make it so that while it is personal, you can talk about it and you feel comfortable, and you do feel comfortable taking care of it, because it is not something that anybody should or would want to live with. Don't just live with it. Just don't.
No.
Ladies, thank you so much for joining us on our first day back, and talking about something that is so important and so serious, but thanks to Lauren in such a fun way with her very aggressive model. And
I have all kinds of fun things here. You didn't even get to see them all. That was just my model. I got all kinds of. I got stuffed vulvas.
Oh, hello.
I got toys and things. I got all kinds of stuff going on over here.
we'll have to have you back with Cheryl.
Yes, that's the first thing I thought of. Like, oh, yeah, we gotta have that. And also, shout out to your background, Lauren, because I've been Googling it this whole time. Like,
So you can find anything on Etsy, right? So those are my family members. So I cut out silhouettes of my family members, and I found somebody on Etsy who makes stencils, and I had him make stencils of the silhouettes of my family members, and so I painted them on my wall. So these are my family members on my wall.
Oh, I legit thought that was wallpaper, and I thought, and I was like, oh, are those like historical Black figures? I mean, I guess they are.
For me, they are. Yes. It's my family.
I love that.
Yeah, that's amazing. Amazing.
My family wall.
I love that.
Thank you. Thank you.
So, I mean, we talked about pelvic floor, but let's talk about Lauren's wall. No, that's amazing, Lauren. That is so beautiful.
I love it.
Thank you.
So beautiful. And you ladies are beautiful for stepping in and talking about it and sharing and being so honest and informative today. So we hope, as usual, that you will come back. We ask everybody to come back again one day and talk to us some more, because I think there's just so much more to be said and so much more that can be learned. And then you can follow Diligent Fitness on Instagram and Facebook. And Lauren, I know you have an Instagram, but is it your physical therapy? Is it your professional?
I put whatever on there, quite honestly. And quite honestly, I haven't been on social media in a while because it's like a rabbit hole for me. So I have to take myself out of it. But my IG is at my museum eye. So,
and we will put all of that in the bio, in the information when we post this. And appreciate you all. Thank you. And everyone, take care of the love below. Get it,
get it tight, get it right.
Get it tight, get it right. Watch yourselves lifting those things, and also take Carly's class. If you're in DMV, see Lauren. We appreciate you. Or you could take Lauren's class if you go to Howard.
Yeah, I get into the PT program.
But who you should not try to be educated by is me.
Or me.
But you could always come back to us for some nonsense and relatively unstable fun. We will see you next time.
Bye.
Bye. Thank you.